sejahtera. I'm Azida from Johor Bahru. Today I would like to present my case study with topic the effect of nurse-led disaster drill training on knowledge and practice of disaster management among registered nurses in private hospital. My introduction. Malaysia is frequently affected by other natural disasters such as landslide, flood, haze, earthquake and other man-made disasters, as well as some rare cases of drought and tsunami. With the growing frequency of disaster events around the world, the need to prepare for education and training need to be emphasized. Nurses should be well and appropriately prepared with knowledge and skill for disaster management. Nurses, all specialties should be equipped with all competencies for disaster prevention, preparedness, response and recovery phase. Disaster simulation has been used as an educational strategy to prepare our nursing for disaster response. Problem statement for my study. Disaster drill training was conducted every year in KPJ-Puteri Specialist Hospital. However, there is still no specific study done to assess and measure the effect of the program to the registered nurse. Registered nurse need to properly communicate with all for the proper coordination during disaster. Registered nurse also must be fully aware of their roles and responsibility during emergency and disaster event. Other than that, our registered nurse were not sure how to use the handling and device and how to respond to the community during disaster event. My research objective. The first one, to identify the level of knowledge on disaster drill training for pre and post intervention among registered nurses in KPJ-Puteri Specialist Hospital. The second objective is to identify the level of practice on disaster drill training for pre and post intervention among registered nurses of KPJ-Puteri Specialist Hospital. Then the third one, to determine the relationship between level of knowledge and practice on disaster drill training among registered nurses in KPJ-Puteri Specialist Hospital. Research question for my study. What is the level of knowledge for pre and post disaster drill training among RN in KPJ-Puteri? What is the level of practice for pre and post of disaster drill training among RN in KPJ-Puteri? And is there any significant relationship between level of knowledge and practice on disaster drill training among RN in KPJ-Puteri Specialist Hospital? Quantitative design using quasi-experimental identified as a research design for this study. Significant use to assess the level of knowledge and practice RN for pre and post disaster drill training. Stratified purpose sampling technique used to all the target population as sample size for this study. The population consists of 40 state registered nurse who is working in KPJ-Puteri with a range of different years of working experience. Pre and post test given to one control group to evaluate the knowledge and practice for pre and post regarding disaster drill training in KPJ-Puteri Specialist Hospital. For research instrument, questionnaire are using for this study. There is a 3 section for this questionnaire. Section A, socio-demographic data sheet information. Section B, knowledge of disaster preparedness. And Section C, practice of participant related to disaster management. My research study done during MCO COVID pandemic 2021. Due to COVID pandemic, no physical training allowed by MOH. However, I'm able to manage by training and intervention by online and mini mock drill in a small group. My research study starting on June 2021 and complete on December 2021. This slide shows the result for the rate of survey written. Socio-demographic data are stated in this slide. For the knowledge, we can see the increasing for post-test result on the high knowledge. The level of practice, pre and post, we can see also increasing on the post-test with the high percentage of result. Current slide show the correlation relationship between knowledge and practice on disaster drill training among nurses in KPJ Puteri. For the result on relationship between knowledge and practice on disaster drill training among nurses in KPJ Puteri show in this slide. On discussion, the result of this study show the positive effect of education on the knowledge and practice of nurses towards disaster drill training. Changes in level of knowledge and practice lead to changes in performance. Pre-intervention results were poor, confirming the need for training in this area. In general, lesson can promote all areas of learning. This program improves staff awareness of existing plan to dealing with disaster, increase staff participation in planning, eliminate problems, and also improve staff skill in performing tasks. Motivation, equipment, maneuvering facilities, workspace, environmental condition are factors that increase of degree of preparation of nurses. Continuing education and appropriate education environment and adequate incentive are ways to increase the preparedness of nurses. According to the survey at KPJ Puteri Specialist Hospital Johor Bahru, nurses were not well prepared for disaster but improved their knowledge and practice after attending disaster drill training. For conclusion, based on the finding, it could be concluded that there are a few respondents have low knowledge and most of them have moderate knowledge on pre-test. But after intervention on disaster drill training, no more respondents are low knowledge and most of them are moderate and high knowledge. After intervention of disaster drill training, there are decreasing frequency number on moderate practice level and most of them have high level practice for post-test. The result indicate that there is significant relationship between knowledge and practice on disaster drill training among RN in KPJ Puteri Specialist Johor Bahru. For that reason, knowledge and practice was important in disaster management. Current slide is a reference during my study. That's all my presentation and thank you for your attention.